So, hello, my dear FMG students. Hope you guys are preparing well for your exams. So, today, myself, Dr. Ajay Maurya, I recently cleared my FMG exam in July 2024, the very first attempt. So, guys, this is the this to make this PDF, guys. To make this PDF, it took around up to 2 months. Okay, now these are my struggle, guys. Okay, for you guys. Okay, so please, first of all, please download this. Please download this PDF. So, okay, where you will get, please go to the Telegram group, to the FMG aspirant AJ Moria, and you can get it from there. Okay, so let's discuss, guys. Okay, please, guys, without knowing these topics, please don't go to exam. Okay, without knowing this topic, please don't go to the exam. Okay, so guys, let's go. I'm not giving any surety that this question will be only will only come. Okay, but it may be. Okay, but these are the some important chapters to topics you have to know. Okay, so let's go. See, so first is the SAM, guys. SAM, severe acute malnutrition. Severe acute malnutrition. Okay, SAM. Okay, category as the age must be more than 6 months. There is a bilateral edema. Weight for height must be less than -3 g square. G square. Remember, it is a weight for height. Okay, it's a weight for height, not the height. Okay, now it's a weight for height. See the what? Mac will be what? Medium circumference will be must be less than 11.5 centimeter. And the treatment will be what? IV fluids with the ringle lactates. What? You have to add the 5% dextrose. This is the question, guys, in the initial examination, the PG also. Can I remember the acute words here, chronic malnutrition. Remember the mnemonic is the हवा. क्या है? हवा है. हवा means what? हवा means गाली, air. Okay, remember it says see हवा, ha, low height for age. It is a in the case of the chronic dwarfing or chronic nutrition. See va, low weight per age. It is in the, it's both combine both acute plus chronic nutrition. Okay, plus acute plus chronic malnutrition is a va, low weight per age. Remember that see the va, WH is the low weight per height. Is here seen in the case of the what? Acute malnutrition. Acute malnutrition. Okay, done. Remember the Glasgow Coma Scale, guys. The Glasgow Coma Scale. Remember the mild is 13 to 15. Moderate is a 9 to 12. More severe is the 8. Okay, remember this one, guys. EVM, electronic voting machine, EVM. So, guys, E for I, V for verbal, M for motor. So, we have to assist. So, what we are going to assist in the GCS is the I response, verbal response is the motor response is the verbal I response is the first one. So, see, the patient is continuously opening the eye, mark the 4. If the sounds, if the patient is opening his eyes with the sound, you have to mark 3. With pressure or pain, 2, none, 1. Okay, remember here, guys, if the patient is well responding, he is conscious and oriented. Remember the 5. Remember the mnemonic is the 1 confused word sounds. 1 means oriented, confused sound means see, 1 confused word. Okay, sorry, 1 confused word. See, 1 oriented confused word sounds. Now remember the mnemonic is the okay. That's good. Okay, remember the patient is obese 6, localized 5, normal flexion 4, abnormal flexion 3, abnormal extension 2, not responding 1. Okay, remember this, guys. Please calculate this one. So this is the painful stimulus. Painful, you have to give the 2. Remember the confused, you have to make the 4. Here the normal flexion, how much? 4. Total is the 8. Total the how much? 10 is the GCS. This is the 10. Remember if GCS is less than 7, then what you will do? You have to do the what? You have to do the intubation. You have to do the intubation. Okay, done. Remember, guys, this is the case. So in the last class examination, they sometimes they will not give the images, but they are going to describe the characters. So for example, in the last exam, they gave us the one patient. It shows what? This was yellowish. This is yellowish nodule. The yellowish nodule at the limb, but they will not give this image. Okay ना, वो image को नहीं देंगे, बस सिर्फ only बोलेंगे कि there is a yellowish nodule. That's it. You have to mark that. You have to know that it is a flactinular conjunctivitis. Okay. Remember, guys, this is the what? This is the what? This is the cobblestone. This is the cobblestone appearance. Where we'll see cobblestone in what? We will see in the ulcerative or Crohn's. You'll see in the Crohn's disease. Okay. C for cobblestone, C for Crohn's. Okay. Here they will give the ropey discharge seen in more in summer season. Remember the VKC. Remember, guys, this is the what? This is the giant. This is the giant papillary conjunctivitis. Okay. Okay. They will see that there is a history of what? History of contact lenses. Okay. Treatment with what? Olapartidine is a antihistamine. Okay, so guys, next coming to the CSF interpretation. See here, guys, remember the here. See here, viral. See here, viral, normal, viral, normal, viral, normal, LLL. In which in viral all are normal. In viral all are normal except lymphocytes. Okay, my dear friends, see in the while you are interpreting what, while you are interpreting the CBC, whenever there is a more lymphocytes, then what it indicates there is a viral fever. Okay, see this is in viral everything is normal except the lymphocytes. Viral normal. Come to here, this is the bacterial. See here, bacteria what? Bacteria love glucose. Bacteria loves to eat glucose. That's why, guys, in the bacterial, see the glucose will be less. TB also called by what? This is a bacteria also, mycobacterium. See, that's why see glucose will be lesser here. Okay, remember in the bacterial meningitis, guys. See in the CBC report, guys, whenever there is a more WBC, there is more neutrophils or PMN cells, it means what? There is a case of the bacteria. So remember here, this is also a bacterial meningitis. See, it is the correct turbid B for bacteria. Okay, this is in the turbid here. In the case of the bacterial meningitis, so it is very easy to rule out. Okay, neutrophils and decrease what? Glucose. Remember in the case of TB, guys, in the TB meningitis, see here in TB, what is happening here? There is a more what? There is a increase in the protein will be maximum. The protein will be very maximum here. This is more than 100 milligrams. So that's why due to more protein, what there is a what? There is a curve. There is a curve wave formation. Okay, there is a curve wave formation. Okay, na? There is a spatter web log. Okay, spatter leg जैसा क्या हो जाता है इसमें curve wave formation due to more protein in tumor. Okay, remember here in the TB and the viral meningitis, there is a what? Lymphocyte will be also normal, will be also increased here. Okay, na? So how you are going to differentiate between TB and viral? In viral are normal, all are normal. In TB there is a maximum protein and there is a cells with the lymphocytes also. Okay, remember this one. Most common cause of meningitis in children it is a mamma. So mamma is a mama in meningo. Adults is the papa fever pneumonia. Done. Next, guys, this is the tension headache. You have to see the band-like compression. Okay, band-like compression is important. So treatment is the answer. Remember the cluster headache. This is seen in what? Is seen in the more in boys. See cluster, luster. Lust. Where you see lust is more common in boys. So it's in lust. See in lust you'll see there is a white drops. Lust, white drops. See it means what? There is a history of what? History of cry. There is a history of salivation. Why? When you will have this cluster headache, guys, then you will have salivation and also lacrimation. Called the epiphora. Treatment with the sumatriptan and the high flow oxygen. Remember the prophylaxis is the CCB. Remember coming to the migraine, guys. See here. It is what? It is due to what? It is to increase in the what? It is increase the CGRP. Calcitonin gene peptide. Okay, it is due to what? Increase in the CGRP. So that's why it calls what? It calls a what? Pulsatile. Whenever just palpate here, guys. One of the patient with the migraine, just palpate here. We'll see the pulse. We will feel the pulse. We will see the pulses here. We see the what? Pulsatile. Okay. Remember the treatment is what? Triptans. Okay, triptans, and there is the sumatriptan. Remember here, sumatriptan is a contraindicated what? Contraindicated in the stroke and the heart disease patient. Remember here, once upon a time they once upon a time they use it to what? They use it to treat the migraine with what? Methyl ergotamine. But what happened? Methyl ergotamine causes what? Causes vasoconstriction. That's why it leads to gangrene. Remember the prophylaxis is the propranolol. And remember here, if there is an obese patient with migraine, you have to give the topiramate. Done. Remember here, guys, this is the GTCS. GTCS, guys, the patient will be suddenly we fell down, will loss of conscious. There is the tongue bite and the clenched teeth. Okay, na? So that's why here, see here, if the GTCS, if the see here, if the GTCS is more than 5 minutes, continue more than 5 minutes, you call that what? Status epilepticus. Okay, for the status epilepticus, you have to give treatment is the IV lorazepam. Remember here, guys, for the GTCS, the actual treatment of the treatment of the GTCS is the valproic acid. But since valproic acid is what? Since valproic acid is very toxic, very teratogenic, and it causes the NTD. That's why I see here for the female who wants to be pregnant. Okay, suppose I am pregnant. Suppose I am female. I want to be pregnant. So I have to go to doctor. Okay, na? Suppose I am female. I am using the valproic acid. Na? So I want to become pregnant. So I have to go to doctor and tell doctor, I want to become pregnant. So what can I do? He will tell, okay, just stop the valproic acid and you can use the levetiracetam or lamotrigine. Okay, remember here, for example, if I am already pregnant and I am using the valproic acid, then I went to doctor. He will tell, okay, don't stop the valproic acid and just add the what? Folic acid 4 mg. That's it. Okay. Remember here, guys, remember this is the salam seizure, infantile spiral. Okay, treatment will be the ACTH. So Down syndrome or myoclonic epilepsy, what? It occurs in the morning time. Okay, there is a bilateral sudden myoclonic jerk. Treatment with the valproic acid or lamotrigine. Remember the subtle seizure most commonly what? Neonates. What is neonates means? Less than 20 days now. See, neonates is what 1 month na. See, 20 phenobarbital 1 phenobarbital means 1 month. Okay. See, the febrile seizure. As far as febrile seizure, okay, na. Due to what? Due to more fever. See the more common seen in the 6 months to 6 years. Okay, na. Rectal diabetes. The absence here also was a petit mal. Petit mal means it is a school going. Seen in the school going children's with a blank aspects like this only. Okay, that's why, guys, there is a there is a low school performance also. Remember, if the child is less than 5 years, you have to give the ethoxamide. More than 5 years, you have to give the valproic acid. Remember, guys, this is the ABCD score of the what transient ischemic attack or the stroke. Remember the age rated age is more than 60, BP must be more than 140, C for clinical feature like speech difficulty, and the unilateral body weakness, defer duration, defer what? The different diabetes called diabetic mellitus score. Remember here, guys, if the recovery within 24 hours, it's called as TIA. If they recover within 72 hours, then what? It is known as what? Known as reversible ischemic neurological deficit. Okay, so here if there is a hemorrhagic gas, you have to lower down the BP. Okay, then you have to give the CCV. The ischemic gas, you have to should not lower the BP and so it will decrease the what? Blood flow to the brain. Remember here, guys, what they are asking in the exam. Say, guys, here, see here for the what? See the for the thrombolytic, guys, for the thrombolytic, you have to use what? You have to use within 3 hours to 4.5 hours. You have to use between 3 hours to 4.5 hours before only. Okay, na? If it is more than, you are not allowed to what? Do the thrombolytics. For thrombolytic, guys, remember the BP must be what? Must be less than 185 to 110. Remember this one. I think everyone knows this one. What? This is what? This is the I like a. This is a nimbu here. What is? This is the SDH. Is the EDH. This is what? This is a crescent shape. Is the SGH. Crescent shape. Just remember what is the artery here and what is the history here. I think everyone knows about that. I think everyone knows about this one. So I can skip this one. So this is subarachana. This is subarachana, guys. Subarachana means what? Remember it is sub-archana. So Archana is bathing in the blood. Archana is bathing in the blood. See here. So what in the case of the SCH, guys? SCH will cause what? Blood in CSF. Remember the rupture of what? Berry aneurysm. Okay. Thunderclap headache. Okay. Just remember this one, guys. Guys, see here in the case of the myasthenia gravis here. Remember here, guys. Remember here, guys, in the case of myasthenia gravis, see, they will ask what is the most sensitive, thing here. The most sensitive is the what? Is single fiber electromyography. For the diagnostic is the what? Hydrophonium. It is the hydrophonium. See, hydrophonium is the for the diagnostic. Okay, na? Not the sensitive. Okay. Remember the drug is what? It is the pyridostigmine. Because pyridostigmine does not cause the BBB, that's a blood-brain barrier. If it is not in the option, you have to mark the neostigmine. Okay. Just remember this one. What dose is here? Remember, guys, remember here is a Baika Basu. Baika Basu is Baika means yes, is Bai means what? See the bicinosis is a bicinosis. Ka means cotton. Bicinosis and cotton. Okay. Remember Basu, Ba means bagosis, Su means sugarcane. Okay. It means it does stop sugarcane. Remember here, guys, this is the bronchitis. Remember, it is the bronchiectasis. Here, the bronchiectasis. What happens here? Bronchiectasis is the what? This is a tram. This is a tram track. This is a tram track like happens. Then there is what? Thickened bronchus, thickened bronchial walls. See, you can see at the tram track appearance. Remember the tram track appearance in the what? In the lungs is also in the case of the bronchiectasis. In the kidney, it is the MPGN, guys, and the fundoscopy CRVO, and the head is the Sturge-Berger syndrome. Okay, so guys here, okay. So guys, remember here, see here, bronchitis guys, it is what? Accumulation of pus in dilated bronchi. There is a what? Chronic productive cough, usually works in what? Morning and often brought born change by what? Change of posture also. Remember here, this is the light criteria for the what? For the pleural effusion. See here, this is the, you have to remember that the light criteria, you have to remember the transudate and the exudate. Transudate and the exudate. Remember here the what are the things included in that light criteria? It is the pleural serum protein, pleural serum LDH, and the pleural fluid LDH. Remember here, guys, the transudate and the exudate. Remember, it is the exudate, exudate. See, exudate, exudate. X U date. We see here. See X. See X U date. See. Are you going to date again your X? No. See, whenever you are going to see your X, you will get the what? Fully what? Fully what? You will be mad. Okay, na? So guys, see, we'll get what? We will get the angry here. Okay, na? Whenever you are going to see your X, you will get the angry. So that's everything, heart rate, everything will going to what? Increase here. So that's why here, X you date. No, I will not date again. See here, more than here. Okay, that's how you have to, that's how you have to, that's how you have to solve the question here. Okay, guys, remember here it is the what pneumonia here cases. This is a curve 65 score. Okay, now Club 65 score, remember here. So if there is a respiratory rate only 25, will you give 1 point? No, I'll give 0 point only. Okay, na? If the age is more than 55, then you have to give 1 marks. That's how you have to calculate the score. See here, if the score is 0 or 1 to 2 or 3 to 5, you have to calculate. So if the 0, it means low severity. 1 to 2 means moderate to severity. Okay, high sensitivity means what? 3 to 4. This is how you have to what? You have to calculate you have to treat the patient. Remember here, guys. This is the what? This is the then if a green zone, it means what? No pneumonia. Yellow zone, pneumonia. Pink or red, it is what? Severe pneumonia. Okay, na? Pink or red is severe pneumonia. That's how you have to only cough. Then you have to give home meds. Cough with tachypnea, you have to give the amoxicillin. And there is a what? Stridor and chest retraction with the IV fluids. Okay, injection. Remember, in the 65%, they will ask the water gene. Okay, water genes. Okay, water gene is CFT gene. What inheritance? AR chromosome 7. What? Okay, what channels are not blocked? It is the chlorine channels. Right? The two are chlorine channels will not block. That's why there is more. There is more what? There is more chlorine in the sweat. Evacaptor is the what? Evacaptor is the what is the drug of choice? Remember here. It is the very chance cause of very thick secretion obstruction known as the what? This is mucositis. Due to this, there is going to be what? There is going to chances of the what? Recurrent chest infection. Remember here the pulmonary embolism what causes DVT and thromboembolism. Okay, na? Remember you have to what What to do? What is the gold standard? CTPA. CTPA. Remember, guys, this is the what? This is the this is what? This is the what? This is the remember here. This is the she is not her, she is not the child mother. That's why child is having what? Anger is a stranger anxiety. Okay, stranger anxiety guys here. Just remember this. Remember the just pause the video and remember all these. Okay, remember this all this what is the month. Okay, remember below on one sequence. Remember guys for the vitamin, remember here guys for the vitamin A, here we are having the for 6 months to 1 year how much we have to give, 1 lakh. For the more than 6 years to more than 1 year to 6 up to 6 years you have to give how much, you have to give 2 liters. Okay, to have to give 2 lakh. Okay, 2 lakh international. Remember here guys for the less than 6 months, 6 months, 6 months children, you have to give how much, 50K. Okay. Remember here, guys, we have the swarming motility, Proteus, gliding motility, Piergoneza, darting motility, Campylobacter, and that's a Vibrio calva, diffing for what? Guardia, shooting star motility, Vibrio, corkscrew motility, T. pallidum, and the lasting motility, what? Borrelia. Remember this. So just remember this one. Remember this one. IgE, that's a hypersensitivity, guys. And also, guys, remember the what? Remember the hyperbilirubinemia, guys. You remember the doctor here. See that doctor. Doctor means what? Doctor means what? Doctor means what? There is a see. Doctors are highly conjugated. See, that means doctor means Dubin syndrome, and R means Rota syndrome. These are examples of conjugate hyperbilirubinemia. Remember, all are autosomal recessive except type 2 is the what? What is the autosomal dominant? Yes, remember the what are the what detection the bilirubin. Remember the Krigler-Najjar type 1 is the most fatal, more dangerous one. Remember this is a physiological short stature. Remember if the family if the question says that their family history with the fish short, it means it's the familial. It is familial. Okay, na? Bone age is equal to chronicle age. If you say that there is a what? There is a history of what? There is a history of delay puberty. There is a history of delay puberty. It means what? They're talking about the constitutional delay. Okay. Remember guys, this is very easy one. I think no need to explain this one. Remember this one. Remember guys here, just remember this ops palsy and clump. This was what this one is the what? Beginning of scapula, what is the at the medial border of the scapula. Here, what much is paralyzed? What much is paralyzed is sarcus anterior myopathy paralyzed, and what nerve injury it is? Long thoracic nerve injury. Okay, remember here. This is the Klumpke's palsy, os palsy due to what? Due to what nerve? It is a C5 C6. C5 C6. Remember, guys, what is here? In the Klumpke's palsy, guys, what nerves are involved? See here, Klumpke's clump, ump, ump. See um means what? Clump, See here, ulnar and median. The most common nerve are ulnar and median. See whatever nerves are, they just throw here. Only keep ulnar and median here in the Klumpke's, and remaining keep here. Okay. Are you done? Okay. It's very clear. Due to what? Due to shoulder dystocia. Just remember, guys. Yes, guys, please remember from the TB. Guys, please remember from the TB and the TB and the anti-diabetic drugs. Guys, you will get the see from this one you will get the one MCQ, and from this one you will get the one MCQ. Okay, remember here. See guys, from the TB drugs, remember they will ask about the what is the mechanism action of beta-acyl what it is a ATP. See ATP means what? Adenosine triphosphate synthase. It is adenosine triphosphate synthase inhibitors. Okay, remember it is ATP synthase inhibitors of the what mitochondrium. What is the side effects? It is see beta-acyl it means what T. Yeah, QT interval prolongation. Remember the isoniazid requires a peripheral neuropathy and between B6 deficiency. Remember the rifampicin gas requires what? R for red day, what? Red day discoloration of the urine. Remember J for what? Paragenamide, para means what? It is the most hepatotoxic. What? Because the increase uric acid and cause joint pain. Remember ethambuta, E for eye, What eye toxicity causes? What it causes? Red green blindness. Okay, remember the delamide. Delamide, what is that? It is a mycolic acid self inhibitor. Most conservative is the, it is also called the QT prolongation. Remember, guys, here the, so guys, remember here, so remember here, when the anti-diabetic drugs, guys, there is a first one is a, just remember this two, see, the SGLT, see the SGLT2, okay, SGLT2 inhibitors examples, guys, what is that? See, fleajolin, fleajolins, okay, remember the dapagliflozin. See, what it causes? It causes the increase of the loss of glucose, increase of loss of glucose in the urine. See, wherever there is more glucose, so there is what? There is a risk of UTI. Bacteria, UTI, what genital mycotic infection, foreign gangrene, and the weight loss. Remember here, guys, this is the what DPP4 inhibitors. Remember, all the names of this class of drugs are like a girl name, like a girl name. For example, this is the Sita, this is the Sita, this is the what? This is Sita gliptin, Sita gliptin, Vilda gliptin, Sita Devi, Vilda Di, Lina gliptin, Lina Ji, Saksha, Saksha Ji. See, all these, what is, okay, all these, all the class of the DP4 inverters are like a girl name. See only, I will choose only what? I will choose Lina gliptin, okay? I will choose only Lina gliptin, okay? Lina ko hi lena. I will choose only Lena. Okay, I will choose only Lena. Okay, see here, see all these class of the drugs are having girls' names. See that, see, girls will always change the DP. That's why see here, they always change the DP means what? It is what? It is a DPP, the DPP4 inhibitors. Okay, done. Okay, now see here, beginners are examples are metformin. Remember the metformins are what? Examples it causes what? It causes a vitamin B2 deficiency. Remember the sulfonyl areas, guys. It is the what? It is the most side effect is the hypoglycemia. Remember it's what? It is the thiazolanidonin. Is the what? Example is the pioglitazone. Remember the sort of the what? Bladder cancer. Just remember this one. I think you know it's HDI and the PQL, I guess. No need to worry about this. This is, I think you know guys know about this one. The frequent trachoma, TB how much? 1,000 rupees. Nikshay, Nikshay for Nikshay for what? Nikshay for TB. Nikshay is the what? Nikshay is the what? Pregnancy kit. Lakshay. There is what? There is Lakshay. Lakshay for what? Lakshay means there is a improve the what? Improve the labor quality. They improve the labor quality room. Okay, Lakshay. Remember guys, this one. Remember this one. Mode of intervention. Remember guys, to solve this, see guys, to solve this question now, to solve this question, you have to remember the, just please study the question carefully. Suppose example that suppose that they are talking about they are talking about the guys health promotion and the specific protection. Okay, na? And suppose like for example health promotion, like you have to sanitize your hand. Okay, na? And also like, or don't smoke. It means what? Why they are telling that don't smoke? It means it causes specific what? It causes the lung cancer. It's the primary. Remember the early. If they are talking about the diagnosis and the treatment, mark the secondary. Tertiary, disability and limitation the rehabilitation. Remember the primordial means what? You are telling to the your children's. Okay, primordial. Children and there is a no, okay, there is a no life, there is a no risk factor. The primordial. Remember gas is the ideally how to go how much? 14. Government of India 4. The government of this is WHO what? 8. And remember the in pregnancy how much extra? Plus 350. Remember the here the folic acid, guys. So in the anemia Bharat Mukt program, you have to give how much folic acid? 500. But normally you have to use the how much? 400 mcg. Just remember this, guys. This remember that. Okay, just try to pause the video and just study this one, guys. Okay, just also remember that this is the absolute contraindication of the what? Breastfeeding. Okay, this one. Just remember guys this one. So remember in this one, in my style guys, this one. Okay, so this is one building, okay, see this is also a one building. See, all the buildings are like what? All the buildings are arranged in the what? Arranged in parallel. Okay, see all the arranged in parallel, guys. See. It is a PSVT. So guys, first of all, you have to see guys. First of all, you have to do what? You have to do the waggle. You have to do the waggle manual. Okay, a catty massage. Then you have to do what? You have to give the adenosine. If the patient is asthmatic, then you have to give the verapamil. See, if the patient is not conscious, okay, patient not conscious, then mark the answer the cardioversion. Just read the question. If they are saying that, if they are telling that the patient is unconscious, then mark that is a cardioversion. This is what this is the RR interloss. This is the irregular RR window. This is what there is a no P. This is no PVS. So this is what atrial fibrillation. You have to do beta blockers. Which is what this is the delta wave. This is the what this is WP double syndrome. This one is the proclamide. Remember here it's a J wave guys. The Osman wave. Sinin hypothermia. This is ventricle tachycardia guys. This is the amiodarone. This is the atrial. This is like a tooth. Like a tooth here, tooth has appearance in the was case of the what? Atrial is the atrial flutter. Guys, remember here, this is the degree of AB block. Is the heart block, guys. Is the degree of heart block type 1, type 2. See here in the second AB block, guys, you have in the Morbis 1 and Morbis 2. Morbis 1 and what? Morbis 2, guys. Here, remember here, guys. This is what? There is a P wave. So the guys see a PR interval, guys. This is just see here. This is the gradually what? Gradually increasing. You see, this is gradually increasing the Morbis type 1. Morbis type 2, guys, is the what? PR interval. What changes here? R here, okay? R interval here changes. But the PR, but see here, PR is here, but the PR interval will be what? Constant, normal only. Just remember this one. Yes, okay, guys. Just pause the video and just pause the video and please try to study this angina also. So please remember this one. This one, guys. This is the aortic stenosis, metastenosis, metaregurgitation, and the aortic regurgitation. Just remember, guys, here is the what? Aortic stenosis. Okay, aortic stenosis. Guys, remember there is a crescendo descendo pattern. This is a crescendo descendo pattern murmur. Crescendo descendo pattern murmur. What you want to see here? This is the what also in the mid systolic murmur also. Remember, the question will always start with there is a patient having what? Syncope. There is a what? Dyspnea or more physical activity. Remember, guys, in metastenosis, they will give the what? There is a opening, there is a what? Opening snap. Remember this one. Opening snap and a mid-diastolic murmur. Remember here, guys, metaregurgitation, you will see the eccentric hypertrophy and the transystolic or holosystolic murmur. In the aortic regurgitation, remember that it is the what? It is a dancing carotis and the Carrigan sign. That is what? This is a Astin murmur. This is the 2 to 3. What happened here? There is a what? There is a ribs fracture. There is a ribs fracture. In case of the fracture, in case of the pleural chest, this is what? This is the full air. Your pneumothorax. This is the what? This is the cardiac component. Just remember this one. Remember here, most common organ injury in blunt trauma. What? It is the spleen. Penetrating means liver. Remember the most common injury in bomb blast. It is if they ask the structure, you mark the eardrum. If they ask the lung, you have to mark the organ. Remember here, most common type of skull fracture is the what? It is the what? It is the leisure. It is the linear feature. Remember here, guys, injury to the seat belts in the what? Mesentery, intestinal biotomy is the most common underwater water burst. Remember here, guys, this is the types of what? Blood loss. You see, it is the class 1, class 2, class 3. Remember here the class 1 15%, class 2 15 to 30, class 3 30 to 40, class 4 more than 40%. Remember here from what class there is a what? There is a BP will be down. It is a class 3. Remember which is the confusion and most lethargic is the what? It is a case of the class 4. So guys, remember here. Guys. This is what? This is the case of the what? This is the rheumatic fever. This is a rheumatic fever, guys. Caused by gas. Gas group A streptococcus. This is a type 2 hypersensitivity accident. Remember here, guys, my dear friends. Remember this is the revised zone criteria here. Remember, guys, you have to just remember the minor criteria. How we are going to remember? See here, fever, increase PR, fever, PR, CR, SR, and R. See, all are R. That's why just remember the minor criteria. Remember, guys, here this is what? This is the ask of body. See here, remember this one. For the prophylaxis, guys, remember here, rheumatic fever without carditis, okay? Without nothing. Then nothing you have to give how much? 5 to 21, okay? 5 to 21 you have here, so prophylaxis. Remember the rheumatic fever with the carditis, only with the carditis, only with the carditis, no heart disease. It is what? You have to give until what? You go 10 to 21 years. Remember here, rheumatic fever with the persistent what? Wallow disease, then you have to give until what? 10 to 40. 10 to 40, okay? No carditis, only 5, only carditis, or no valve disease is at 10 to 21, okay? Just under here, with all, okay? With combining all, we having the valve diseases, everything, what? You have to give 10 to 40 years. Just read the question and mark the answer, okay? I think no need to tell about this one. Catas, everyone knows. Okay, just try to find it. This is what this is the what. This is for the semen. For the semen, guys, we having two things. For semen, we having the barbados and the barbados and the fluorescent test. Barbados and the fluorescent test. So for barbados, guys, you will see the what? We'll see the yellow needle shaped crystals. For the fluorescent, guys, you'll see the what? You will see the for the you see the dark brown rhombic crystal. For the guys to in order to distinguish between the if the bone is for example, if the bone is by humans or animals. Further, this we have to do the what? Precipitin test for the what? For the species identification. Remember, this is the blood stain. You have Takayama crystal and the Teichmann. For Takayama is the pink feathery, brown crystal hat, Teichmann crystal. Remember. Remember from the hernia topics, guys. The most common in the female is the what? The most common hernia in female is that is the indirect. Okay. Remember it's the indirect. If they ask you what the if they ask you female hernia is most common in, then you have to mark the female, not the males. Okay. Remember. But overall most common is the what? Female is that indirect. Okay. Na? Male is direct. Remember here, guys. Just remember here how to you are going to differentiate between the direct and indirect here. Remember here, but the indirect, guys. So there is a triangle called a Hazelback triangle. Okay, na? If the content are coming from the triangle, guys, is the direct. If they coming from the lateral side, guys, is the indirect. Okay, just for in the lateral side, we are having deep inguinal. Okay, na? So here, see like this here. See how you are going to how you are going to distinguish it like a by that, and you can distinguish by what is distinguished by inferior epigastric hernia. Inferior epigastric hernia. Remember this one and remember this one and NYH classification, guys. There is a what? So if they wrote the 3A means it is direct. 3B means both direct and indirect. 3C means femoral. 4 means different. Remember here, guys. This is what this is the they are doing the hernioplasty here. By what? It's a mesh repair. It's the proline. This is the proline. The metal is proline. Remember that in the open surgery, it causes what nerve injury? Ilioinguinal. In the laparoscopic surgery, these are the lateral cutaneous nerve of thigh. Okay? It causes what? Meralgia plastica. They will say the history of a woman undergo laparoscopy of the hernia and she having a tingling sensation. It means the meralgia plastica. Remember, guys, this is a congenital hernia. Remember, you have to do the herniatomy after what? After 3 years. Remember, guys, this is the omphalocele and the gastric omphalocele, sealed, omphalocele. Remember, omphalocele means what? Seal means packed. See, that's all the content of the herniated all the herniated content are packed here. All the herniated content are packed here. See, that's why it is the omphalocele. See, what are the contents of the omphalocele? See, all LL means or liver and the intestine. Remember the gastric cases means what? Gastric means what? All the gas means are leaky. See, all the contents are leaking outside. Remember this, we are having two eyes means what? III, it is only intestine is the content. Okay. Remember, guys, this is very easy. Just remember this one. See here in here, see drug of choice for the drug of choice for the first cigar for the medical terminal pregnancy. First you are see MEFI, for MEFI. So the MEFI piston you have to give. First of all, you have to give MEFI piston. Then out of 48 hours gap, you have to give misoprostol. Okay, just remember, guys. remember the terms and conditions. I think everyone knows about the MTP, guys. No need to explain. Remember here. So remember here, guys, is the trichomonasis, what vaginalis. See, remember here, this is the what? This is the strawberry and this is the leafy. Here, remember it is the, so for example, is the, we will see that there is a what? Strawberry service with the what? Green means there is a greenish discharge. Okay. So remember here, I went to buy strawberry via metro. See, I went to buy strawberry via metro. Metro means taken with the metro nidajor. Okay, na? See, how the metro moving? Is a teaching material. Remember the bacterial vaginosis is what? Caused by Gardnerella vaginalis. We have in the Amsel criteria. The fissure due to a release of amines, web test and the clue cells. So means what? There is a clue cell means what? There is a vaginal epithelial cell loaded with the what? Loaded with the organism. Loaded with the organisms. Okay. See, this is the clue cells. This is the clue cells here. Or drug choice is mainly the metronidazole, but other drugs you can use clindamycin. Remember here, guys. Remember the candidiasis, guys. The candidiasis. Remember is a curdy cheesy discharge. Remember your temperature will be less than 4.5. Drug choice fluconazole 115. Remember here, guys. Remember here. This is the case of what? This is the herpes. See here. These are the painful. And these are the painful, guys. Okay, and these are the most painful are herpes and the chancreas. Herpes and the chancreas only. See here, cry means what? Crying, cry also see the chance most because they are crying because they are is painful. Okay? These are the examples of the pain. These are the examples of the painful. Okay, painful. These are the examples of painful. Remember here, chancreid do cry. Okay, na? See, school of face appearance, azithromycin. Here the herpes simplex guys, this is the what? Virus, this is the what? Multiple vesicles. We have water here, treatment with what? Acyclovir, 800 milligram, 5.5 times per day. You will do the what? Chunk smear. The what don't know what this is. Remember here the what? Guys, it is what? It is the beefy red color. Beefy red color. Okay, now there is a what? Breaks easily here. Pseudobulbous here formation. Remember that here donoanosis. Remember here, this is what? This is the, so remember here, this is the case of the chlamydia trachomatis. Chlamydia trachomatis are see caused by the chlamydia trachomatis and it causes what? LGV. Okay, na? LGV. See here, it is a green blood sign and the what? Elevated round oval single ulcers. Okay, na? Here. There is what? There is a true purpose here. L1, L2, L3 are types. There are types are L1, L2, 3, and the vulva is the most common site. Doctor said. Just remember this one. Just study the diabetes, guys. Okay. This one for the best for the check the current sugar levels, guys. It is the what is the FBS. Okay, na? For the long time, it is the HB1C. Okay, remember, guys. Just remember the normal values. Remember here the normal is the 5.6. Just reverse this one, or just reverse the 5.6. It will happens what? It will become 6.5. Okay, na? Just reverse the 5.6. It will be 6.5. It is the for the HbA1c. So guys, remember the DKA. You have to remember the what? There is a fruity smell. Okay, na? There is a fruity smell, and okay, remember remember the what is the management, guys. So you have to add insulin. How much? 0.1 unit. Okay, so this is the what you have to do, what you have to remember from the DKA. So guys, remember that there is a okay. Remember the primary amenorrhea and the, see see guys, in the entire gynecology, guys, whenever they will mention that there is a primary amenorrhea with the option uterus, guys, you have to think about these two. It's a mullary and the complete genesis. Okay, just remember the karyotype, gonads, axillary hair, the associated. Actually, on it. So this is the further what this is the saddle joint. This is the first the carpal and the first metacarpal. Okay. See, this is the balls of examples. These examples here. This is the examples and the here primary and the secondary here. Primary are synchrondosis, guys. Here primary asynchronous is also called what is synostosis because they are not temporary, because they are afterward they are going to become what? They are going to form the bone. That's why it's called synostosis. In the secondary, it's called the permanent, usually permanent only. See all the midline joints here. See geometry, epiphysis, and diaphysis. This is the syndesmosis. Remember, please remember this, guys. arches. And the, I think everyone knows about this slide. Okay, na? Can I skip this one? Okay, I will skip this one. This one also, I will skip this one, guys. Remember, this is a V8, T10, and a T12. Okay, just remember this is also last year question. Okay, if there is a what, they will mention that something happened, the something from the mouth to, and suppose from the mouth to that location there is a what, there is a 23 centimeter, and then where does you will reach the arch of aorta, just like this one. Remember here, guys. Remember here, if they says that there is a, if there is a person going on a road and he fall down in the manhole. Most commonly it is a bulbar. With the motorcycle, it is a membranous urethra. Remember here. Remember here, this is the what amino acid is the tyrosine, melanin, T3, T4 catecholamines. Tryptophan means fan. You see the what? Fan, you will sleep. Sleep means melatonin. Huh? Fan, you will sleep. Melatonin, serotonin, vitamin B, and what? And, the vitamin B3, niacin. Histidine will get what? Nitric oxide. Glycine is the heme synthesis or purine. Just remember the ETC, guys. Okay. So I think no need to explain this one, guys. I think everyone knows about this one. Okay, Pakka, sure, done. Okay, just remember that. BCKD here for the maple syrup disease. What enzymes? ILV means what? It is the ILV, isolation leucine valine. Okay, remember that it is a Leishman syndrome. Just try to study this one. I think everyone knows about this one. Galactose, see lactose, lose. What you lose? Girlfriend. I lose my girlfriend. See, lose my girlfriend. See, galactose plus fructose. Galactose plus fructose. See here. See, galactose, lack. See, lack. See there. Lactose plus fructose. I will lose my girlfriend. See here. Sucrose is my GF. See, S my GF. Glucose, sucrose. Glucose plus fructose. This is LGG company. Lactose plus galactose. Remember here, this is the what? This is the lysosomal storage area. You have to remember about that. You remember that. This is the Gaucher disease. Gaucher disease. Remember that. What is the enzyme? Enzyme is the beta glucocerebrosidase. Chromosome 1. What is the what? This is a bone pen. Gaucher. Ouch. Ouch. Bone pen. This is what is the crumpled paper appearance. Crumpled paper appearance of the bone marrow. Yeah, okay. Just remember this one, glycogen storage disorder. Remember this one. This is own work. Okay, now own work. What enzyme? Okay, remember that there is a severe fasting here, and there is a what? Doll, moon, or doll like faces. The see, guys, remember this is like this one. A B C D. A B C D. See, A B C C A B means what? Anderson branching enzyme. C D chorus enzyme. What? D branching enzyme. Remember the myocardial guys. It is what? It is in the what? Seen in the muscle who are going to who are doing the exercises, guys. Remember the what are the tartan sulfate, guys. See, remember the in the cornea, guys. What you see the tartan sulfate. Just remember this tablet. See here, guys, for the what are the lysosomal storage disorders, guys. See, and just read the what are the enzyme deficiency here. Okay, Demontix, what is Phingomyelinases, like this one. Fibers, ceramide. Just remember this table. This is the Hartner disease, guys. It is a pellagra-like syndrome. It is a pellagra-like what symptoms. See, guys, in the last exam also, there we are going to, they just confused like this. There is a pellagra-like symptom. All the students kept what? All students kept as a carcinoma tumor. But remember that Hartner positive, this is a positive, it is a potato sensitive. See here, this is a what? Photosensitive. So it is a pellagra. It is a pellagra-like symptom. Remember this one. Okay. Now this is what is a 8 word, 18, E for 18, downs 21, P for patav, padamudu. This is a padamudu. C, this is a patav for 13. Okay. 13. Remember this, they mention like this is triplets here 18 and triplets here is just what 21 down syndrome. Remember the from the mitochondria inheritance, guys. See all here. See all the diseases are all the diseases here. All the diseases are transmitted from the females only, not from the male. Yeah, just remember this one. Just study the example in your search in Google. See CGG, repeat CGGGGG fraga ga 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 GGG ga ga ga. See CGG fragile. CTG ga CTTTTT motor motor motor. See CTG and the motor dystrophy. See here ga 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 friend. Here the friend Gana ga raha hai. Friend Gana. This is a Huntington. There is a hunter, and he having the case. He having the case here. You know, hunter is very dominant. So hunter disease is a autosomal dominant, and he having the cage. Cage is having how many walls? Four walls. So the hunter disease is the this is what? This is a chromosome 4. Cage is spelling CAG case. Done. Just remember the what are the examples here, guys. See Patau, see the here the Patau syndrome, Patau syndrome, see cleft cleft lip cleft papa see the papa Patau. Okay, then see adverse of have low set, yes, short neck here. Remember adverse. Remember Down syndrome with the low IQ. Yeah. So here this is the Turner syndrome and Klein syndrome. I think everyone knows about this one. Okay, then this is the mania. This is the mania disease, guys. See manias. Men will wall. Men will always rise. Remember the manias is manias. See is the presbycusis in age. Is if you see here that in the case of the what? In the case of the aged people, they will fall. That's why I say the fall. But this is the hertz now. This is the hertz now at what? At what? At the 20 at the 2K here 2K. Hertz machine the otosclerosis. There's a 4K in noise induced hearing loss. Remember, guys, this is the pregnant female with the connective hair loss. See guys, every time for the otosclerosis, guys, for the otosclerosis, every time the history will start like this. There is a young pregnant female with conductive hearing loss. Just mark the answer mark the answer the otosclerosis. Okay, is what this short sign. Just mention the just remember there is a young female pregnancy. Okay, now just and having a conductive hearing loss. For the glomeruli, this like the rising sunshine, pulsatile tinnitus, bleeding ear. In the city, you will see the felpation. Acoustic neuroma, what? Tumor of apical nerve. There's a rollover phenomenon. And we have in the Hazelberg sign here. Remember the choice is the what? MRI with the gallium. Just remember this as so bubble here, so bubble here. This is the what? This is the X means or X cartilage here. So this is the onion-like appearance. This is what? The nudist osteoma. What? History of Raat ka dard. This is a night bone pain. The sunburst happens in the osteosarcoma. So just remember the okay, guys. Remember these triads. Okay. Remember these tracks here. Okay, na? Remember this is the what? This is the fossa. This is the fossa of Rosenmuller. It is site for what? It is site for the NPC, nasopharyngeal carcinoma. It is most common in China. Okay, na? It is associated with the EBV virus. Okay, na? Just remember. Treatment with the chemotherapy radiation. This is the ET. Okay, guys, see here in the case of the CML and the AML, guys. See here in the case of remember these important topics. Okay, this is the CML. In CML, you have to remember the CML is the splenomegaly and the more what basophilia. Remember the basophilia will be more and the field of chromosome what 922. Treatment will be what imatinib. Imatinib is also in the treatment of cyst. Remember the AML. In the AML, guys, there is a what most common is AML type 2. Remember the DICA associated with what? Associated with the AML type 3. Remember the ALL, what's in what? It's in the what? Childhood. ALL is in childhood. It is associated with the Down syndrome. Next is the CLR is the what? Is in the elderly, very well in the elderly patient. You will see the smudge cell. Use the smudge cell here in the CLR. Just remember this. See, by seeing the age also, you can mark the answer. I think everyone knows about this. Everyone knows about the diastatica. You have to remember this order. Just remember, note the gastric enteritis is the most common disease. Vitamin A is the most deficiency. You have to give the vaccine, tetanus toxoid. I think everyone knows about this one. No need to explain. And this also no need to explain this one. And also you remember the Industry Act. In the Industry Act, minimum age is 14, and for 9 hours per day, you have to 48 hours. You have to do the work. Allowed is the work. Maximum include overtime is how much? 60 hours. Just guys remember about remember about the vaccines, guys. Just remember, okay, just remember only one thing. Just remember the only one, like either live or killed one. Okay, you will get the questions here. Just remember the last time question they asked, HBV is the what, it is the recombinant. Remember the at birth what vaccines are given. So that's just please remember the stains. Remember the stains, okay? Remember the stains here. What are the stains are there? What are the stains? Remember them. Measles are important and BCG is important, guys, and the measles, rubella is important here. Measles. Okay, guys, remember the here the what are the side effects of the remember these, at least these side effects are the what side effects of the vaccines here. Okay, measles must what it TSS. It is the what? It is the Tourette syndrome. So for the BCG, guys, it is the for causes it causes a lymphadenitis and osteomyelitis. DPT shock. That's why the patient who is having the what seizures, they are not allowed to do the what, give the DPT. Remember the maximum chance of cold fever where subcenter in the village. Remember here the most sensitivity for the what iron is the what, it is the serum ferritin here. Serum ferritin. Remember guys here, if the MCV is less than 80, it means the microcytic anemia. Remember the Seatal. Remember here the if there is a remember here the if there is serum ferritin is more, obviously there is going to be TIBC is more. The ferritin is more, then is the TIBC is more. This is going to be inversely proportional. High serum ferritin, low TIBC. Low TIBC, high serum ferritin. Just remember this one. See the iron deficiency anemia, guys. There is no iron. Okay, there is no iron here. See, all are decreased. What? Only that TIBC will be what? Obviously, there is everything. Obviously, there is when there is going to be ferritin is low. Obviously, then TIBC will be high. Immerse anemia, guys. Anemia, there is what? There is iron toxicity. Remember that due to what toxicity, there is more iron. More iron. Obviously, there is going to TIBC will be obviously decrease. Remember here, the MC will more than 100. Megaloblastic anemia. This is the between B12 and the photo. And this is the folic acid. The folic deficiency. We will see the CNS symptom. CNS symptoms here, and there is no CNS symptom. Only there is a risk of AMTD. Remember the methylmalonyl what? Methylmalonyl-CoA here in the increase will be increases in the case of the B12 deficiency and normal here in the folate deficiency. Remember here the what are the things that are going to increase and decrease the what iron absorption here. You have to remember this one. Acidic pH, vitamin C, phytus, and alkaline most concentrated duodenum. Let's remember here that one thing. Remember here in the case of the what, in the case of the, see here there is a, they will mention there is a respiratory burst, and what is the respiratory burst enzyme? It is the NADPH. What is the diagnostic test is diagnostic test is the what, it is the DHR. For the screening it is the NBT. In the case of the CGD, okay, chronic grammatics disease. And remember the cardiac also. Guys, you remember is the Burkitt's and the multiple myeloma. Remember the Burkitt's, guys. Burkitt's is like just assume the B as the 8 here. See the chromosome number is 8, and just remember the 14. 8, 14. Remember the multiple myeloma, multiple myeloma, EL for 11. The chromosome is 11, 14. Just by remembering these chromosomes, guys, you will mark the answer. Okay. See, okay, na? Done. Remember here, if you see the Russell bodies, here, example, there is a Rasam. Rasam means Ra means Russell body, Ma means multiple myeloma. Remember here, it is the what? It is the disease of what? Disease of plasma cells. We'll see the bony, we'll see the bony-lytic lesions here. Remember here the types of necrosis, guys. Here types of necrosis here. Okay, now that's the necrosis. See here, this is the brain. This is the liquefatic or collicative necrosis. Remember, this is the BAP. BAP means brain and the abscess and the pancreas, parenchyma. Remember, this is the cases necrosis, guys. This is the what? The CG like TB, histoplasmic sarcoidosis. Coagulative here, the fat necrosis. Remember here the remember the tumor markers. Remember the beta HCG, HCCCC, CCC, chorionic. Calcitonin, remember the calcitonin what? Calcitonin is for the medullary carcinoma. Carcinoma thyroid tumor. This is the what CA19 means 9 like a P, pancreatic tumor. Remember the marker. Guys, please remember the squamous cell lung cancer here, lung cancer, squamous cell carcinoma, adenocarcinoma, small cell carcinoma, and large cell carcinoma. Remember the see here. S for smoking. Center for what is pronounced like S. So S for smoking, center for it is a central locator. So small cell is the small is the smoking and center. Remember, guys, one thing here for the adenocarcinoma, this is a non-smoker. In the question, they will mention that they will mention the patient is non-smoker. You have to mark the adenocarcinoma. If they say this is smoker, you have to look for this too. Remember, you will see the creatinine pulse here in the squamous cell carcinoma, but in the small cell carcinoma, you will see the vasoparity effect, and it is also called wart cell carcinoma. Just remember this. This is the gist, guys. This is the gist. You have to remember the what are gene, KIT, PDF, GGR, SDS, and BRAF mutation here. Remember, it is also called as the most missing GI tumor, and what is the hematogenous spread and originated from the Cajal cell. It is the pacemaker of the GIT here. Remember the T22 is the immune tissue. Remember the here you guys remember the thyroid carcinoma here. See here the papillary means papillary popular. Papillary means popular. It's the most common here. See here, we will see the orphan ani. We will see the sum of bodies. What is sum of body? It is the dystrophic calcification. Remember the what where we will found the where we will found the sum of bodies. The follicular F means what? It is not diagnosed in the FNSA. For follicular FNSA, it is not diagnosed in the not diagnosed in the FNSA. Remember the medullary. See guys, this is the very very muddy fellow. See all the cancers are originating from the follicles, but this guy is originating from the parafollicular cells of the C cell. What does C cell do? C cell will increase the what? Will what increase the calcitonin here. See the medullary carcinoma is associated with the men 2A and 2B. Just remember what is the most sensitive. See here remember this one cell cycle gas G2M. See M means what? Just for check remember G for G2M, M for more sensitive, M for more sensitive, S for sensitive. Just master the table, okay? Guys, please see this one. Guys, please see this one. Uh, See this one is the Kawasaki disease and the HSP. Okay, Kawasaki disease and the HSP. Remember that the most important table is the Kawasaki and the HSP. Remember the Kawasaki disease which is what? Remember the cream conjunctivitis what is a non-exudative. Okay, non-exudative rashes from pulmonary edema, idiopathy, cervical adenopathy, mucosal environment. There is what? There is a strawberry tongue here. The fissure lip. Treatment with the IVIG. Remember the HSP, there is IG vasculitis. Remember the purpuric rash at the lower limb, mainly at the buttock. If there is abdominal pain, colicky like presentation. Ataja, there is what? PSC. Remember it is self-limiting. Treatment with what? See here, guys. When you have to start the steroids. When there is a GIT involvement. Okay, remember this is the vagueness, guys. Just study like a vagueness. Study like a vagueness is what? Remember is a vagueness. It is it's the vagueness. C means it's Sianka body. See only Sianka body. Sianka body will be only seen where we seen in the case of the vagueness disease. In the vagueness disease only we will see the Sianka bodies. Okay. That's the vaginal glomerulus also, guys. You will see the strawberry like tongue here. But remember, guys, here we will see the upper and the lower respiratory tract infection here. This is the giant cell arteritis, guys. You have in the thrombic lateral headache and the vision problem. If you see this one, guys, you will mark the answer. The giant cell arteritis, also called temporal arteritis. See, this is the Nagma and Hagma. Okay, now see the non-anionic gap acidosis. Remember the non-anionic and the high anionic. Remember the rod is this Remember, only one disease rad means tubular acidosis, Addison disease, estrogelamide, aldosterone, diarrhea, right? In the GIT cases, rad. Remember that is the epiglottis group. Remember guys, one thing here, for the most common cause is the staph pneumonia in the immunized patient. If they particularly ask in the unimmunized, you have to mark the hib. Otherwise, you have to mark the this is the thumbs up, this is the stipple sign, right? Parainfluenza virus. Remember here, guys, this is the, remember here, the gray color for the what? For the what? For the glucose. For the C, anticoagulant is the potassium oxalate, additive is the sodium fluoride. What does sodium fluoride what do? Sodium fluoride will do what? They will do it causes the amylose enzyme inhibition. Remember the what? Remember the Remember the main to A, main to B guys. Okay, you have to buy her this. You must buy her this one. Remember the guys. Remember the cones and the addition issues. Okay, just remember Please study the cones. Just remember the cones, guys. Just remember the cones, and obviously the opposite of the cones is the addition disease. Okay, the opposite of the cones is the cones disease is the addition disease. Just make sure that there is no edema. Everyone thinks there is hypertension, so there is edema, but in cone disease there is no edema. Yeah, just opposite is the addition disease. I think you have to. I think you guys are pro in the vitamins. Okay, na? Remember the SS here. SS is very important. I think I will skip this one. Can I see the carcinoma tumor and the pheochromocytoma? This carcinoma tumor, guys, this is what? This is overproduction of what? This is overproduction of serotonin here. You know, see here that there is just remember here, guys. There is just screen test is the what is the screen test? It is the 24 hours HIAA one indoor acetic acid level monitor here. Remember the inflammation. System fibroids. This is the system fibroids, hepatomegaly, intestinal diarrhea here. There is skin flushing and the asthma-like. There is the asthma-like feature. Remember here in the case of the pheochromocytoma, guys. Remember here in the case of pheochromocytoma, guys. Remember it is the what? It is the chromaffin cell tumor. What mainly mainly adenomedulla. Mainly adenomedulla. Okay. We'll see the triad sweating, headache, palpitation, or increased HR, but no BP here. For the screening, 24 hours fraction methamphetamine VMA level. For the confirmation, you have to use the what? Plasma-free metastasis, you have to do the MIGB scan. And remember here, guys, this for the intraoperative, what is the IV fentanyl? Postoperative, albuterol. That's so guys, remember so guys, please remember here they will just please see the catching points here. If they see that there's a optic chiasma, mark the answer the bitemporal hemanopia. Bitemporal hemanopia. Okay, na? Optic chiasma. Okay, na? Just see here. Optic chiasma, mostly they're going to ask about the bitemporal only. Optic nerve, it is the what? The homonymous hemanopia. Remember, guys, here this is the important one. They will give the images. You have to see this is the macular sparing. Please see that they're asking left occipital lobe or left occipital. See left. They are either asking about the occipital lobe. If you see the occipital lobe, there is a what? There is a macular sparing. Remember that. If they mentioned about the occipital lobe, guys, it means they are talking about the macular sparing. Okay, just remember that one in the exam. See, guys, this is the dexamethasone suppression test, guys. See here, guys. This is the dexamethasone suppression test, guys. See here the low and the high. Low dose, guys. See low means actually it will cortisol must be low. See low. See low means normal. See the cortisol levels. See here the cortisol levels are high. It means low he. Low he. It is a what? Due to what? It means it is a Cushing syndrome. Remember the he low means hydroxysteroid and low, it is a helo. This is what is the Cushing disease. There is a pituitary adenoma. There is a he low. It is a high dose dexamethasone and the high cortisol. And there is a low STT. It means it is the adrenal and question is here with the he low. He is the ectopic acidity. Remember this. Just remember, guys, this one. This is the circular billis, guys. This is the circular billis. Remember here the see here, which is not found by it is the MCA, middle cerebral artery. Remember this one. Remember, guys, is the remember the what are the cranial nerves are not involved in the are not present in the midbrain, pons, and medulla. Just remember this. Okay. Just try to remember the just try to remember the what are the parts of the. Okay, so for example, they mark here is the fourth canal, fifth, sixth, seventh, like this one. Just remember the cranial nerves number. Do you remember here, guys? This is the one more. Okay, guys, see here this is the case of the see this is the so this is the C for what? This is the caudate nucleus. This is what? This is the internal capsule, lentiform nucleus. This is the thalamus. This is the left ventricle. This is the corpus callosum. This is the choroid fibers. This is the choroid fibers. Okay, just remember. Yes, guys, remember this one. See, guys, here. See here. Here, guys, this is the gluteal medius and the gluteal minimus. Gluteal medius and the gluteal minimus supplied by what? Supplied by superior gluteal nerve. See, guys, if there is an injury to the superior gluteal nerve, will gluteus medius and minimus work? No, they will not work. What the function of gluteal medius and minimus? They are abduction. So will it help in the abduction? No. That's why the patient will be large. Will be what? Will bend. That's to get the support here. Is it support here? So will lurch. Okay. So this is the case also. This is the case. Remember the gluteus maximus is what? It's the inferior gluteal nerve. At the function at the extension at the hip joint. Yeah, guys, please remember the order here. Remember the order here. Is everyone knows this is the what? Mallam party score for the what? For the intubation to check the intubation. Remember the ACA classification, guys. Class 1 for the healthy without comorbidities. 4 is for what? Brain dead. Just remember this. Remember the oxygen color for the oxygen is the black color body with a white shoulder. Nitrous oxide with the blue body. CO2 is the gray and the helium is the brown. Remember this is the AON here. A for air, O for oxygen, N for nitrous oxide. Remember the A for oxygen is the say here the 1,5, 2,5, 1,5 air, 2,5 is the oxygen, and 3,5 is for the nitrous oxide. See 1,5, 2,5, 3,5. Remember it is the pipelines here. This is for the overdose of bupropion. You have to give what? Give the 20% interlipid. Remember the study about the propofol, guys. Propofol is like a palu, it is a milk-like. The milk-like. So it is the milk in color, milky color. Remember, guys, it is the what the compounds are egg albumin, and the soybean oil. Remember, it is a contraindicated in case of the contraindicated in the case of egg allergy patient. Okay, egg allergy patient here. Okay, remember here. It is the most painful. It is the most painful IV induction. Remember here. Remember that 13:2 for what? Adult, 15:2 for the pediatric, and 3:1 for the neonate. Remember, it's the mepholson. What is mepholson F? It is in the pediatric. See, remember, if you can't F, then how come you are going to protect the? Then how come you are going to protect the children? The F. Mepholson D what? The adult. Remember the Hoffman animation. It is the what? Atacurium minus is atacurium. Safe in children, sevoflurane. Breast milk for the what? 4 hours. You have to stop before surgery. While full meal you have the 8 hours. Remember the posterior puncture. So after doing the lumbar puncture, guys, you will get the headache. For that one, it is the caffeine is the recompense. Remember this one. Second class effect is the what? Nitrous oxide. Remember this one. This is the Suraksha clinic, guys. Suraksha clinic. Everyone knows about the Suraksha clinic. Suraksha clinic here. Remember this one. Guys, remember. So guys, remember here the vaginal erosions are also comes under the kit 1 only. Okay, na? Remember there is a latest update is the kit 8, the brown color for the annual rectal discharge. This is the what? This is the scaly silver scales in the case of what? This is psoriasis. We'll see the Monroe's microabscess here. The gutted psoriasis was a raindrop. It's under the history of what? History of a sore threat. You have to give the antibiotic here. The pustular psoriasis, guys. Remember the Corbin's. This is the Corbin's phenomenon seen in the. Remember the Pallavi. It's a Pallavi. See, psoriasis like and vitiligo. Remember the leprosy. Lepra reaction type 1, it is the type 4 hypersensitivity. Type 2 is the type 3. Type 2 is the type 3 hypersensitivity reaction. Guys, please remember the what is the red touch meter can't see, can't be, can't bend. It's the Alport syndrome, guys. Can't be, can't hear, can't see. Red touch syndrome, what is red touch syndrome? It is the staphylococcal scarlet syndrome. It is the what? This is the lacy reticular. Lacy reticular variant. It is called as what is bodies. It is the histopathology, which is the CVT bodies. Decoplakia. Guys, remember the some example. Remember some images from the dermatology, guys. The melasma, melanoma. Then it's your job to see them. Okay, just please pause the video and you can just see the what are the different images here. Okay, guys, here this is the desmoid, guys. You have to do the what? You have to do the oxygen granula. It is the what? Just remember the swelling where at the sublingual glands. Not the translumination positive here. Remember the types of wound, guys. Here, guys, remember here the types of ulcers here. Remember here, guys. Remember here the sloping ulcers in the or healing ulcers in the case of the venous ulcer. Puncture out ulcers in arterial. Undermined is in the TB. And there's a rolled out ulcers in the case of the basal cell carcinoma. And the averted here the in case of the marginal ulcer. Here obviously the marginal ulcer are always associated with the bone here. Remember here the fetal session is a minus 30. Remember, if it is minus, guys, you have to do the CS. If it is plus 0 plus 1, you have to deliver by the normal delivery. Remember, guys, there is the impending eclampsia. Impending eclampsia, guys, there is a history of headache and a blurring of vision. Okay, impending eclampsia. You have to do the MGSF in the laboratory, the intraoperative what label. Remember guys, for the management of the eclampsia, guys, this is the picture. This is the Pritchard regimen. Remember the loading dose and the maintenance and the therapeutic dose here. Remember guys, before giving this one, you have to check for the it's DTR, deep reflect positive. Urinary output must be more than 100 ml in a 100 ml in 4 hours, and RR respiratory must be more than 14. Antidote is the calcium gluconate. Just remember that what is that? If there is gel class, it means MGS for concentration it is more than 10. Here, let's remember this one. Remember here the laboratory is the first choice. If there is a what? If the patient is bronchial asthma, you have to give the nifedipine. Remember the gestation hypertension what? After 20 weeks. Chronic is the what? Before 20 weeks. Remember the placenta previa, guys. Placenta previa means what? It is the painless bleeding. The painless bleeding and it is soft and non-tender. Remember it is dark with the pain. Biopsy means what? Biopsy means rupture, the pain. Remember guys here after pregnancy, guys, management here. Just remember the management. When we will do the management, this is the criteria, this is the triad. The drug of choice is the what? Methotrexate. See here, guys, this is the diabetes and pregnancy. We'll see this one. Wait. Which is this one? This is the diabetes and pregnancy, guys. So, guys, what you have to do? You may remember, guys, you have to do the how much? How to do the 75 grams of the glucose. Okay, before we are going to do the what? We're going to the random blood sugar. Okay, 75 grams. Remember this is the first insulin. Insulin is the first drug of choice. Okay, na? If the insulin is not work, you have to give the glyburide or metformin. Most common is CVS. Remember, most specific is the sacral agencies. Fetal is the macrosomia. How much? The more than weighing more than 4 kg here. Just remember the treatment here. Study this one. So guys, here coming to this one. Okay, done with one. See here, this is the important science, guys. Please remember this one. Okay, we have the importance pregnancy sign here. Remember the lochia, guys. Remember it is a rubies. It is a rupees. First rubra, then is a first is rubra, then siroja, then alba here. Remember the Leopold manual. I think everyone knows about the manual, guys. They will just give the images and you have to mark if you want or two. Okay. Guys, please remember that this is the shoulder dystocia, guys. First of all, you have to what? You have to call for help. Next, you have the make robots manual. If the make robots manual is what fails, then you have to do the what? Do the suprapubic. It fails, you have to do the wood card skill manual. It is failed, guys. You have to what? You have to do the what? Gas skill manual. It means it is roll on the four. It is last is the what? Last is the January manual. It means you have to push back to the head of the and you have to prepare for the CS. Remember the types of abortion, guys, here. Okay, most commonly the what? Chromosomal abnormalities. Recurrent is what? It is a 3 or more consecutive spontaneous abortion before 20 weeks. Here. Just remember these two, threatened and inevitable. Done. Remember the guys. Remember here during the first trimester only we have to stop the warfarin. Okay, na? And we have to stop the warfarin and you have to give the heparin here. And rest you have to what you have to continue the warfarin here. See here. Remember why you have to stop warfarin because it causes the what? It causes the cartilage. It causes the cartilage problem. It causes the cartilage problem. Remember, guys, the difference between the polyamorous and the oligohydramnios. Please study, guys. Okay. Just remember, guys, for the OHS, there are multiple BB follicles aside the history of IVF treatment. Remember that there is a small follicles arranged peripherally here. Remember, it is the letrozole is the first choice. Just study this one. What is that? This is the twin pregnancy, guys. Is the DCDA here, DCDA is the lambda sign here, MCDA, T sign is there. Remember the most common is the DCDA division occurring in the less than within 72 hours. It is the DCDA 48 hours, MCDA more than 8 hours is the MCMA more than 12 days is the conjoined. Remember the most common is the thoracophobia. Remember the all are symptoms all are same only but different fingerprint here. Please study this one. Please study this one, guys. Okay. Just remember this one. Cardiac output come back normal after 10 days. Remember here the all cardiac factors are increase except 11 it decrease. Just remember this. Guys, here is the extra mileage from the OB-GYN. Please study this one, guys. Okay. Remember the most common is the gynecology. Remember the face to face is the delivery is the anthropology here. Just please once have a look up this. Guys, these are the snakes. Remember the neotogic are what? Cobra and the kite here. The cobra having the black spot here. So sorry, cobra in the spots here. Kite has the black spot, the white spot here. Most common cause death is the respiratory paralysis in the arrest. Remember here is the hematotoxic. That's a viper. V for vessels is the blood vessels. Okay. See here the diamond shape. Most common death is the failure. Remember this one. What to do for the snake bite? Drugs are ACV, atropine, and neostrobin. Remember here, guys. Remember here the inquest here for the see here the magistrate inquest here. See here we are in the judicial and the executive. Judicial and the executive. See here the all the yellow color. See DDR, death, disappearance, rape in custody, everything. See is by what judiciary. Only the dowry death and the exhumation by what executive. Remember here and also remember here we have the low to high here. Remember here, guys. Remember here from where the fine is unlimited. It is the chief GM, guys. Okay, and also remember who will give the death sentence. Who will give the death sentence and the lifetime imprisonment? It is by National District and the Session Judge. Who will confirm? High Court. Guys, I think no need to study, no need to tell this one. Just remember, guys, okay? Remember here the technique, guys. If it is only pH is normal, guys, it is the compensated, nothing normal partially. On the CO2 and the H is the normal, it is the what? Uncompensated. Remember pH remember the pH is the 7.35 to 7.45. I think everyone knows about this one. Just remember. This is from the guys. This is from the extra mileage from the microbiology. Okay, remember this one. See P P P P P P P P P P E P P P Pasani P P P diarrhea. E T T T T T T T diarrhea. It travel diarrhea. I D dysentery. HHR hepatic anemia uremic syndrome. Remember the Stain is the O out of O57. Remember the color is the what? The TCPS is the what? TCPS is the what is the TCPS? It is the culture media. Rice water to increase camp. Salmanna Basu, remember the best media is the Wilson Blair. Remember the mnemonic is Basu. In the first week you have to do the blood culture. Second week you have to do the ignition test or the viral test. So as for the third trimester, in the first third week you have to do the stool culture. In the fourth week you have to do the urine culture. Remember that is the remember the this one guys. Just study this extra malaria guys. Next one is the okay this is the malaria. I think everyone knows about the malaria guys. Please study this one. Please study this. Okay. That's why please study this about this one. Pyogenic versus amoebic and the hereditary. Remember this is the water lily sign. This is the lily sign. This is the what more thick more patches here. This is the amoebic liver disease caused by what? It is the antibacterial. This is the small scattered here by what? It is the bacterial matter. Okay, just remember that here the serology we have to. Let's see the histogram. Okay, everyone remember the continuous frequency polygon for midline frequency here the frequency curve here. Line diagram for what? Line diagram for the trend here. Ogive here. Only frequency will increase. Scattered dotted order also called as correlation. Simple diagram, no gap here. Multiple diagram here the simple diagram there is gap. Multiple diagram what? There is no gap here. Component what? One by one component. Remember is the stem and leaf. What is it for the? It is similar to what? Histogram, funnel plot. This is a forest plot for what? Meta analysis. Nikshay, what I told about this Nikshay for the what? TB here, Nikshay here, the Nikush for the what? For the leprosy here. Remember here the case versus the here the cohort versus study the cohort versus the case control here. Please study about this one. I think everyone knows. If you see here, remember the red disease, you have to case control. For the rare is the cohort control. Guys, remember the for the cohort guys, it is the what? It is the forward looking. The case control is the it is the backward. Please while solving this type of question, please study the question whether they are asking about the forward or backward. Remember the strength of the odds ratio is the R related ratio. Okay. Just remember the Parkinson versus the Alzheimer's disease, guys. Okay. Remember this. Just remember the what are the diuretics acting on the what nephron here. Just remember this is what is the thick loop of Henle. What is the loop of loop diuretic examples what are furosemide here. Is it DCT what LDCT hydrochlorothiazide. Estrogelamide here and what are the things are there. See here. Okay. Wait a bit. Spironolactons are acting where at the collecting duct here. Remember this is a TGGG egg. Tapman here. Tapman or snowman. This is a similar snowman. It is a box like part here. What for the lithium index. Option normally. Remember tetrazoid what the inclusion tetrazoid. Remember guys, just remember what are the side effects of the lithium here. Just remember guys, here we have the hypothyroidism, not the hyper. Just remember here, too much diabetes insipidus. Remember that. Just remember the side effects of the remember the PCB, Pakistan Cricket Board, ML nothing. Pakistan Cricket Board, ML nothing. In the what is the amyloid. Remember in the amyloid we have in the both hyper and hypo. But if they are specifically, you have to mark the it is the hypo. Just remember the bore wave versus the what melody. See, remember it is just here. What see here the in bore wave we have the triad. It's the Meckel triad. The Meckel triad is the chest pain, vomiting, subcutaneous emphysema. In mare, the history will be same only if they give the chest pain guys. You have to mark the bore half syndrome. Remember, guys, this is the series. Okay, congenital diaphragmatic hernia, guys. What you have to do here. You have to not to do the bag and mass ventilation is contraindicated here. You will see here what is the boil loops are in the what in thorax. It's the Boschle. If the hernia is left side, it is called as Boschle hernia. Right side Morgan. Remember, guys, in the what you do, remember, please study about the please study about the interoception and the mechanical thing. You have to remember the see here it is the recurrent red current jelly stool. Red current jelly stools here, but see the red current jelly sputum you will see in the case of the Klebsiella pneumonia. See here, guys, this is the what you have to do. You have to do the what you have to do the contrast here. Hydrostatic or pneumostatic reduction. Okay, na? It means what happens in inception. But you see here, there is a what it's like a एक पाइप में एक पाइप घुस गया ठीक है that's why there is a telescoping that's why you have to remove this one that's why you have to put the water or the air in there so that it will tight. Metals here, remember the residue or persistence of vitello intestine. Remember the diagram here. This is technical is important here. The husband what more than 48 hours. Just remember this what this is the extra mileage guys. Just please study this one. Remember the gastric and duodenal ulcer here. I think you know about the this one single double triple bubbles guys here. Remember the Crohn's disease here. Okay, just please study this one guys because of low time here for me. Remember the myopia, guys. You have to remember the images here. What light falls in front of what in front of the retina here. The patient will always quizzes the eye to see the object, but here the patient will rub the eye here. You see, convex lens. Okay, it's the what for the remember the astigmatism, toric or cylindrical lenses. Remember that this is the what this is the retinoblastoma here. Retinoblastoma. You see the what gene is the 13q. What is the most common leukoplakia here? Remember the chemo here. You see the flexion intestinal rojette. If this is the glaucoma, this is the congenital glaucoma, guys. Congenital glaucoma is the both thalamus here. Remember the this one catalyst, guys. Okay, this is a network like here. Viral. This is what this is the green color. Is what bacterial. This is the fungal here. Satellite like listen. Acanthamoeba is what is the ring shape also. Guys, please master this one. It's your duty to master these images. Remember that Wilson and Menke disease and Kawasaki marasmus. Just please study this one. Also, guys, please study this about the types of poisons here, guys. Please study this one. Okay. Most important, thallium here. This is thallium here, datura, and the cannabis, opium, guys. Here, just please study this one. Okay, see here, guys. This is the for the muscles, guys. Here, see if it says that there is a contact, there is a what stellate shape and the elevated. See here the SBT, singeing, burning, tattooing. Remember, guys, if there is a only tattooing, there is no burning and singeing. It is the case of what? In the case of it is a near shot. If the only all present SBT, it is the clear shot. The distance they will mention contingent numbers. Remember the types of autopsy, lectives, witches, gons, and rocket. I think everyone knows about this one. Remember the types of the fingerprint. Remember the A-shaped, Y-shaped, modified Y-shaped. Remember the burns guys here. What areas? Head and neck 9%, anterior and posterior trunk with the 18%, arms 9%, genitalia 1%, leg 18%. Remember guys here. This is the degree of burn guys. For the first degree, what happens is the only reddening and swelling or pain epidermis. In the second degree, guys, what happens? It is a reddening, blistering pain. It's a blistering in the second degree. Just remember this one. Please just remember the poisoning, guys. Here, and just remember, guys, here for the acute iron poisoning, how to give defruximine. For the chronic, how to give defiprin. I think everyone knows about this one, guys. Just here, just knows about the snub box and remember the names of the names of the bones here. Okay, the posterior tibial artery. Remember what the answer for the superficial perineum, the only for this part. Just remember what are the parts here. Just remember, guys. I think here most of the students are going to mark the answer. Is that it is ready or not? But remember, it is the aspect lateral aspect of the forearm. Okay, now it is by what? Muscular. Remember only these parts are what? Ulnar. Only this only middle. Only this part. This is the what is the median nerve, ulnar, radial nerve. Just remember this one. Remember guys, this one. I think everyone knows about this one. Okay. This is also okay. Everyone knows about this one. JVP, everyone knows here. Okay, also knows vocal nodule, singers. Okay. Done, 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 done. See, nodule is have double side here. This is also knows PCT is the what maximum chances here. And also for what objection here. This is also knows primary and active, primary active and secondary. If it also knows about when it is the contraction state there, here deadline will come on the deadline will not come closure. Okay, only the on the relaxation guys will come. Remember guys, for the here we are in the for myosin guys we have in the head, we have in the two banding, we have in the actin banding and the what and the ATP banding. Okay, now whenever there is a what ATP band and the actin band, there is what there is a contraction here. There is a contraction here. So the see here the actin is the thin filament and the thin protein and the myosin is the thick one. Okay, myosin is the thick one here. So here while contraction there is a Z line will be normal only. See here relaxation there, while relaxation there is a what the Z line will be what plumb closure. Please study this one, guys. Also, you know about this one. Most important is the sodium hypochlorite. Guys, I don't know how you're going to remember, but at least please remember the original dominant here. Sorry. This is what 6 years is the middle line here. Middle line. What you will do surgery system. Remember the what you are going to remove the surgery. Okay. This is the what Ludwig Angina. What history is the dental care. Remember here. Remember here, guys. This is the anterolateral brachial cyst. Brachial cyst. Remember the posterolateral. What is it? Cystic hygroma. Guys, from the vascular surgery, guys, please study this Boyd's classification, guys. ABP, Wallis, Raynaud's phenomenon here. Just remember the and also study about the deep vein thrombosis, varicose vein. Okay, na? Guys, from the breast part, please remember the what is the remember study about the breast abscess, Paget disease are important one. Remember from this here, guys. Remember that T4A, T4B, and T4D is important here. Remember, guys. Remember, it is the only one important here. This is the Indian file pattern. Indian file pattern we seen in what in the lobular cancer. Okay, na lobular invasive cancer here due to what the loss of E catheter. Remember the here is the P. Remember in the while doing the chemotherapy C in the C. In the case of the pre-menstruation, in the case of the pre-menstruation, guys, you have to give the tamoxifen, and guys in the post-menstruation, guys, you have to do the letrozole, estrogen, and the exemestane. Yeah, the treatment. You know, this is a leaf fold 1, 2, 3. You want the access, guys, access here. What is the use for the Cadwell V, Waters V, and the Pyrrhus V? Just remember. This is the AS, so this is the tympanometer types here. This is the labyrinth, and this is the function here. Just remember the functions here. It's the Bera, guys. Bera for what? For NICU baby meningitis. For most common is the OA. Remember this is the what? This is the CSF rhinorrhea, halo sign. Beta 2 is the transfer in the confirmatory test. But remember that T20 is the T20 is the conservative. The surgery is the first here. Okay, so guys, these are some extra mileage from the ENT. Please try to study this. Please pause the video and study this. Janka I told you this is the what from the Chilean diagrams from the thyro and the cricopharyngeal muscle. This is the fossa major for NPC. Laryngomalacia what? This is the omega. Remember the types of striders here. Remember here the case of the induction nervosa, guys. Here the BMI must be what? Actually here the patient is already underweight, but again she think about that she is fatty. That's why she will restrict the energy here. Bouillon nervosa, the patient will eat more in the very short duration. That's why they will put the They're vomiting, purging gas reflex. That's why the HCl will also HCl will also come. They form the what? The eroded. Remember that. Just remember the guys, schizophrenia guys. This is remember what are the symptoms and the treatment here. Remember guys is the MSc for the orientation. What you have to ask the question, time here, attention, and disease forwards. This is the program. Remember the types of phobias here. Depression. Remember the depression guys. Most common is the low mood. Bipolar here. This is trichobeja means what? It what? Due to eating of the what? Eating of the hair here. Remember here the remember here the what here ekathesia guys, or the treatment is the propranolol. Parkinson syndrome is the dose reduction. The antipercussion agent here. Say tardive dyskinesia, you have to go what? Valbenzine for the N means the NMS is the NLMS is the neuroleptic malignant. You have to use the what? Dantrolene. For the acute dystonia, you have to go benztropine. Just remember here you have to remember the what are the things included in the cluster A and the cluster B. Just remember the only one cluster A. It's the OIF of the sigmoid fluid. Is the word remember here. That's the OCD. Repeatedly. The gas is the family. Is the family gas cycle. Yeah, you have to remember the order and the definition. I will come about this one in the further video for the slides. Wait. This you have to remember this one. Lead time is between what and the screen time between what. I will come with this one also. Remember this one. There's achondroplasia what? Champers glass pelvis, bamboo spine with what? Ankylosing spondylitis. This is the rickets here seen in the children or the vitamin D deficiency. This is the what? This is the posterior dislocation, guys. Remember here. This is the further. Further means further flexion, adduction, internal rotation. This is the what? Flexion, abduction, external rotation. Further. So guys, please read your own provided PDF, guys. Okay, this primary edema is a bad shape. You see, pneumothorax here. See here the pneumothorax means pneumo means hydro means water, pneumo means air. See, this is suppression here, like this suppression. Okay, now please study this all. You are on your own notes here. This is the milia. The milia means this is like a seed, like a seed here. Seeds like eggshell here, silicosis here, pancreas tumor. This is canal by metastasis. Just study about this guys, all this in our own. PET scan will the primer you will use the or primer fluorodeoxyglucose here. Just study all this. Remember guys, one MCQ from this one types of splint here. Please study this all. Fractures, Monteggia fracture, Galagi, Collis and Smith fracture. Copper fracture here. Boxers, Ponet and Ronaldo fracture here. Just guys, this is about this, okay? I think everyone knows about the competitive and non-competitive. What are the included here? Also, this gluto. Remember here, gluto 2 is the insulin independent, gluto independent, and what is this one? Gluto 4 is the insulin dependent. Remember the types of collagen here. Remember the LDH, and also guys, remember the what the glycolysis. Remember the what are the rate limiting enzyme here. Most important cholesterol here. I think everyone knows about this one, guys. Just remember this one. Okay, guys. From the nephrology, guys, if they says that the history of cancer, malignancy, you have to mark the membranous glomerulopathy. If they says the history of HIV, you have to mark the hepatitis. Remember, this is the fibrosis. If the children, this is the in the you see in the case of the adults, you see this is the cyst, many cyst here. Remember the definition of the definition nephrotic and the nephratic. Nephrotic is the nephrotic. Nephrotic is a nephrotic massive proteinuria. The most common is the MCD is the minimal chain disease. Remember that is the nephratic with the gross hematuria. Remember the example is the PH. Remember the guys is necrosis and the nephrosis. Remember the dystrophic and the CAD dystrophic what? Calcium is normal. Metastatic calcium is increased. Remember the example. Remember this in the MI gas, what is first rises and what is first. Remember the very earliest is the what is the IMA, ischemic modified albumin. Okay, remember guys, just remember. Just remember the this one the label this one. This is the remember the sterols are threonine, lysine, pulses, methionine, lysine, maize, what? Tryptophan, lysine. Remember, guys, what is S1 for the isovolumetric contraction? Remember this one. Remember the when will be the first heart sound, second heart sound, guys. And also remember the what is the baroreceptor CVS reflection. Yeah, the latest updated. This is what sandfly here. Okay, sandfly here, guys. Sandfly here. Okay, this is sandfly here. What causes the visual analysis? Kala Ajar. Red week, see red like red week for the what? Americana trypanosomes. This is the remember the guys. What are the diseases caused by lows here? Remember. And also there is nothing soft with their heart. Remember what are the diseases for the soft and hard tick. This is the guy. This is the remember the food poisoning the point source here, and this is the typhoid due to contaminated well and water is the multiple sources. Ujjwala, and Ujjavala. Ujjala is for the what? Ujjala is for what? It's the LED lights. Ujjwala is for the what? What? In the natural gas, it is the LPG cylinders. It is the Ujjavala for the trafficking. Remember, is the dental fluorosis. Fluorine is more than what? 0.8 here. These are the important. Remember, is the Horrocks apparatus for what? For the chlorination demand is the chloroscope for the what? For the measuring amount of free residual chlorine in water. Remember the sling psychometer for what? Measure the air humidity. Kata laga cooling power of air. This is a wind vane for the what? For the direction of wind. Remember this is the he looked what 45 degree here the female national mosquito here, guys. Remember that this is the having the wings, we are the on the whole body, we are having the white spot is the Aedes aegypti vector for this one. This is the hunchback, guys. Hunchback. The coolest mosquito is the fully black here. There is a sparkling on the legs only. Mansania, remember that. Hypertension, guys. Tip is the educated is the whole community. Yes, so remember the ESI. Remember the sickness benefit for 2 years. How many? 80% wages. 91, 70% wages. Remember. Centimeter here. Second stage for midterms of different. Salter scale is the and the hypertension factors. Cold chain is here. Cold chain here is for the head pack. Here, how many vaccines? Only 2 vaccines. Remember, it is vaccine carrier here. Okay. How many ice pack? 4 ice pack. This is for the National Program of Control of what blindness. Remember, guys, what is the definition of blindness? It's the less than 3 by 16. Remember the lesma here, low vision blindness, economical blindness, social blindness, manufacturing. Remember the ranges. And Shishu Suraksha, guys, what are the included here? Just see. Vaccine volumeter, guys. Okay, just see the marker here. This is the full what is white is the good to use. Nothing here now is some only here. It is darker, it is lighter, it is the okay to use. Remember the mission in the is what are the vaccine included here. Just remember study as a garroting, Bansutola and the gagging here and gagging, the what smothering. Okay, just remember all these guys. Okay, this is the what it is caput, succedaneum, and the cephalopotamus. Yes, cephalopotamus, remember the succedaneum is only causes the suture line. It is what? It is the suture line causes. It means what is, see, if you are going to success, what you will do? You will cross the limit. That's remember the crosses the suture line is the succedaneum. And with the Bharat program, remember the 666 intervention. You must remember the salary of the ASA in the low performance stage and the high performance stage. Okay, na? Or 2000 low ASA will take only 600. Remember. Lipis loop here, Mirena here. You can see here, guys. It's the Chaya and the Antara here. You see here, Malaya and Maladi. Only available in the shop is the Maladi. D for Dukan. Remember the means is a coplis part here. Rubella, guys. See the what? See the PDA here. The pair में अंधा बहरा अंधा प्यार and PDA अंधा means what? Cataract बहरा means HNHL. Remember the mom's guys. What is the most common complication of orchitis? It is what it causes bilateral parotitis, and but most common complication is the orchitis here. Remember guys. Monitor snakes there. Sea snakes are what? Mytology here. Remember all this. Please study all these guys. Okay. Here also study this. You have to please study all these also guys. Haley and Daly here. Remember the what are the things which are included in the less than like CDF4 is less than 500, 250 here. Remember that these are important. Remember guys for lathyrism guys is the BOA for beta oxide so amino element. Remember the spastic persist of lower limb here. Vitamin C the proprietary. So see guys, you have to see the what? We'll see the there is a what swelling here. Remember this guys. Study this table guys. Okay. I think you know about everyone knows about cannula, hypoxia. Please study. Mycetoma here and the chromoblastomycosis and the chromoblastomycosis. You have to study this one guys. Okay. Types of the stones here guys. Please study. Okay. Appendix guys here. Appendicitis. Remember the taxonomy type 1, type 2. Type 1 is the what enzyme is the fumaryle ester. Type 2 is the transaminases. Read about the fistula guys here. Okay, na? Please remember the upper, middle, lower. Remember see the exam how they ask the middle means what? What is the middle two? It means what? Vesicovaginal fistula. See is the vagina. All the ureter, urinary bladder is going to contact each other with the vagina here. Remember the bathroom cyst here. Remember guys here for the MTP guys here. The first trimester you have to what? You have to get the 50 only. After delivery you have to get 300. Remember the triple marker test and the quadruple marker test here. Remember what is the fundal height? The below umbilicus are 20 weeks, above umbilicus 24 weeks like this. Remember the order guys here. Engagement. See the lactation sequence, myogenesis, lactogenesis here. Remember here 12 weeks at puberty base. You remember the difference between the hyper and the hypothyroidism guys. And the Cushing syndrome. Remember disease means what? More acidious and both D for double. Disease is the more acidious and the cortisol. Syndrome is what? Increased cortisol and decreased acidity. Remember the parathyroidism guys. Parathyroidism. What IOC is the technium or TC Antanium systemic scan. Remember this. Remember the guys is the heart failure types. Okay. And the types of socks here. Remember this guys. Remember this one very very important. Lange and the Lange incision and the coitus incision. Okay. That's a please remember the typhoid test I told. This is the which is already and which is ketolase. Remember this guy, they will give this one as you have to remember the Jonla Gamroja Facilitata Reticularis. That's it all from my guys. Oh my goodness, okay. That's all from my side. Please guys, please revise everything. Okay, please revise everything. Okay. So I hope you will get the up to 60 to 70% from this class. Okay. Wish you all the best, very, very best guys. Okay. Thank you very much.